Care for one, that's love. Care for hundreds, that's nursing. Teach hundreds to care for themselves, that's a revolution. Hi, my name is Chris Hapgood. I've been a nurse for 30 plus years, and I'm starting this YouTube channel just because I really have been told that people need to hear my message. People need to hear my voice. People need to hear that there's hope for their health. Let me kind of tell you, I'll start off with my story. Back in 2010, I was diagnosed with grade 4 arthritis in both of my knees, and my lower back was really messed up. So for my hobby, I would do long distance competitive trail riding, meaning I would ride 40 to 60 miles a weekend. And I was in a lot of pain. And so in addition to the every 6 month steroidal injections in both of the knees and in my lower back, I would have to take 6 to 8 Percocets or Loratabs a day. Yes, 6 to 8 Percocets or Loratabs a day just to make it through the ride. Sometimes I would be in the saddle like 8 hours at a time. So I would have to start pilling up a couple of days before the ride. I would be using those pills during the ride, popping those pills while I was in the saddle. And then I would have to be doing more pills 3, 4, 5 days afterwards because I was hurting so bad. Then my daughter said, "Mom, you really need to try this little blue cream stuff." And I'm like, it's not going to work. It's not going to work. I just have to keep doing what I've been prescribed to do. So she gave me a challenge. I started putting on this little blue cream every couple times a day. And after about 2 weeks, when I was riding, I noticed, oh my goodness, my pain is a little less. I didn't have to take as many Percocets or Loratabs. Is there something to this? So I turned on my science brain, and what I realized is the harm that I was doing every time I took one of those opioids, the harm that my body was going through. And then I started looking at, well, what's the deal with all this natural stuff? Well, then I started realizing my body's going to work. My body welcomes this natural stuff. My body could really heal itself just using this natural stuff. Then I realized I was so excited about this new stuff. I was learning more and more. I was going into the evidence-based research. At that time, I was working for a big hospital, a teaching hospital. I would go and I present all of this this evidence-based research to the people that it mattered, to the docs, to the other nurses. And I was just laughed at. The people would go, "What are you talking about? That's not our hospital policy." So then it really hit me that our medical model truly is broken. That all we're going to do is treat everybody's symptoms, and we're not truly going to the root cause. So I couldn't be a part of that anymore. I just left. I left, and now this is what I do on my own. And I help people with their health issues that maybe they don't even have any hope, that they're just giving up because what they're currently doing isn't working. So this is so empowering. This is finally, I get to do nursing my way. So I'm going to encourage you that if this is something that this is kind of resonating with your soul, with what your heart believes, that maybe I want to hear more what Chris has to say, because believe me, I have many more messages. I want to get on top of the rooftops and scream that people do have a choice, that you need to be making informed decisions about your health. If this is something that you need to hear, then I'm going to encourage you. encourage you to subscribe to my YouTube channel so that I can get more of these messages to you, so that we can start making connections. Because like I said, I'm here to help others. So subscribe to my YouTube channel, and let's start thinking outside of the box, and let's start getting solutions for you, because our health and our wellness is the most precious gift that we have. So take care of it. You only have so much time. Thank you.